Hi, thank you everyone for joining today. My name is Dr. Nasir and I'm part of the medical team at Neuro. Today I will lead the medical department, speaking to all of you uh, regarding potential treatments for stroke available at Neuro. Today is International Stroke Day, so I think it's a good time to, to talk about stroke and talk about available treatment options. As we know, stroke is a devastating medical condition. There are two types of stroke. One is hemorrhagic stroke, which is caused because of a blood vessel rupture, for example, or maybe um, vascular aneurysm, which is a vascular deformity in the brain. And we also have ischemic stroke, which is the more common type of stroke, which is caused by maybe a blood clot or other cardiovascular problems. Stroke results in long-term morbidity and also premature mortality in many suffering in many people suffering with stroke. Um, in terms of the treatment options, conventionally speaking, physical therapy, rehabilitation, antiplatelet therapies are the most common treatments available for stroke survivors. But once there is a certain level of neurological damage, it's extremely difficult to reverse. Normally, the neuroplasticity in the central nervous system is very limited once there is any kind of insult to the central nervous system. So this results in extremely um, devastating long-term loss of motor function, sensory function, spasticity, and secondary complications in those people suffering from stroke. So there are some alternative options available for stroke survivors. There are two options. One is the neuromodulation, which we are specialized in, and also the stem cell treatment. In many people, we combine neuromodulation together with stem cell therapy. So let's talk about a little bit more about neuromodulation. So neuromodulation is basically um, a term used to describe um, a way to make functional use of leftover pathways or leftover tissue. Neuromodulation is used to induce a little bit of neuroplasticity by external stimuli. It could be physical therapy, it could be external electrical stimulation to, to induce some neuroplasticity and improve functionality in people suffering from stroke. Um, in terms of neuromodulation, there are three major types of uh, electrical stimulations which are being used to treat people with stroke. The most common one is the motor cortex stimulation, which is basically the epidural stimulation implantation over motor strip after a small craniectomy. So we perform a small craniectomy, basically make a small placement into the cranium over the motor strip in the prefrontal cortex, and we implant a plate of electrodes into the motor strip, which is used to provide motor cortex stimulation to those suffering from stroke. So this is the motor strip, which is responsible for a great majority of motor functions, including upper body function, lower body function, speech and swallowing functions. So once there is implantation of motor cortex stimulator, it provides very precise electrical stimulation to the motor cortex, and it results in excitation of upper motor pathways, or the leftover pathways which survived the insult after the stroke. Once there is a certain level of external electrical stimulation, it causes the excitation, and then it communicates with the lower motor neurons, which are responsible for direct motor functions. The second type is deep brain stimulation, which is basically it's not like superficial stimulation. It's a little bit deeper in the brain, and this is used in some people primarily suffering from stroke, from Parkinson's disease, but it could also be used for people suffering from stroke. Deep brain stimulation involves stimulation of certain structures in the brain, and it results, especially in people with diffuse axonal injuries, and it can result certain level of neuromodulation, neuroplasticity, and improvements in those functions which had been lost after a stroke. The third one is higher cervical stimulation. It's a slightly less invasive form of neuromodulation. It's actually very similar to what we do for many people with higher cervical spinal cord injuries, or some people with brainstem injuries. Some patients with, for example, brainstem stroke, or the stroke in the lower brain centers, they are qualified for higher cervical stimulation. In higher cervical stimulation, normally the implantation is over C2, C3 level, and it provides a certain level of electrical stimulation to the cervical spinal cord and also the lower part of the brain stem, and it results in functional recovery in upper body and lower body. So using these three types of neuromodulation techniques available, we can target various types of stroke, and we can recover a great deal of motor function. We can see improvements in spasticity and also neuropathic pain after the neuromodulation treatment. The second type of treatment which we do at Brighton Neuro is a stem cell treatment. So stem cell based treatments are being used for people for more than two decades now. Stroke is one of the most common medical condition which is being used, which is being treated with stem cell therapy. Stem cell treatment involves transplantation of stem cells into either into systematic circulation using intravenous injections, or through intrathecal injections where stem cells are directly injected into the cerebrospinal fluid after a lumbar tap. And the indications for stem cell treatment are, I would say, like more standardized type of stem cell treatments are minor stroke, and some people with traumatic brain injury can also qualify for a standard stem cell treatment. The purpose of stem cell treatment is to produce a certain level of neuroregeneration. Stem cells, they have strong anti-inflammatory, anti-gliotic properties, where they are able to reduce the astrogliotic scar tissue. They are able to release growth factors and proteins, and those growth factors can enhance the function of existing nerve cells. They can protect the nerve cells against oxidative stress, glutamate toxicity, but they also promote certain level of regeneration, where they are able to cause direct regeneration of nerve tissues. Once stem cell treatment is combined with extensive physical therapy, occupational therapy, speech therapy, we are able to translate this recovery in the central nervous system into functional recovery, where patients are able to see functional gains in their lost functions. For some people with very severe stroke, if there is a very, very focal neurological deficit, which means there is a very big focused area, there is a very big, massive ischemic or hemorrhagic stroke involving maybe a whole lobe or even multiple lobes. We can target the injured area using what is called a stereotactic craniotomy and transplantation of stem cells into the cerebral cortex. So this is a very specialized technique which uses a very it's a type of robotic surgery basically, where we use a stereotactic frame which is connected with a CT scan machine. The neurosurgery team is operating the CT scan machine to basically guide the needle which is inserted into the motor cortex. It's a very, very precise procedure, and there is a lot of imaging available. So there is real-time imaging available where we are able to localize the needle into the damaged part in the cerebral cortex, and we are able to transplant stem cells inside the actual damaged spinal cord. So this is called craniotomy and stereotactic transplantation of stem cells. This is, of course, a slightly more invasive method. So we keep this only for those people suffering from more severe form of stroke, again, with very massive stroke, with huge area, with huge neurological deficit. So these two types of stem cell treatments are being used to treat people with stroke, along with neuromodulation. Many patients, they are qualified for a combination of stem cell treatment and a neuromodulation, because we understand it's extremely difficult to regenerate the nervous system tissues. So once the damage has occurred, generally speaking, the neuroplasticity, the neuro regeneration is very, very limited. Um, it's extremely difficult for stem cell treatment alone to really cause enough regeneration to see significant functional recovery in lost functions. So we believe a combination of stem cell treatment and neuromodulation, either it is like a superficial motor cortex stimulation, for example, deep brain stimulation, or higher cervical stimulation. This combination with stem cell treatment is the best treatment available to stroke survivors. After the treatment, both treatments, stem cell treatments and neuromodulatory treatments, we perform very, very vigorous physical therapy, occupational therapy, speech therapy, locomotor training, extensive stretching for extended periods of time to see functional gains. Mhm. So this is the brief overview I wanted to talk today. So I will see if there are any questions. Please let me know. Well, I think Pichi is asking what causes a stroke. Stroke is, there are different types of stroke. The most common cause of stroke is cardiovascular medical conditions. Many people suffer from vascular diseases. They have vascular um, thrombosis, which can basically travel to arteries in the brain, and it can cause um, the the blockage of blood circulation going to the brain. So this is called ischemic stroke. Some people suffering from cardiovascular conditions, they also have blood vessel rupture, where there is a rupture of the blood vessel in the brain, which can cause the accumulation of blood um, into the cerebral tissue, which is also a type of stroke called hemorrhagic stroke. So my message to people suffering from stroke is conventionally, there are few options available for stroke survivors. Physical therapy is one of the best available methods to continue to preserve the muscle mass, muscle strength, and try to prevent complications such as curvature or other secondary complications. But there is very, very limited regeneration after a stroke. So stem cell treatment and neuromodulation are, I believe, the best neuromodulatory treatments which can result in functional recovery in those suffering from stroke. Mhm. So if you are suffering from stroke or your loved one suffering from stroke, please feel free to drop us a message. You can contact us using our contact details. And we will get back to you for further details. So we have a question from Kidus. Firstly, are there any developments with the stroke therapy or anything? Yeah, so I think the neuromodulation treatment is being developed, and it's definitely the future of stroke treatment. The regenerative treatments, such as peptides or stem cell therapies, have been used very extensively to try to recover the neurological damage, but the recovery had been very, very limited. Generally speaking, after stem cell therapy or other kind of peptides or other regenerative treatments, the neuroplasticity is very, very limited. Many people, they see changes, but the changes are not very functional, which means they still have limitations in performing their activities of daily life. So we believe neuromodulation is probably the best treatment available at the moment, which actually results in functional gains, which means people are able to get back their independence. They're able to regain functional use of their hands, their lower body. They're able to see significant recovery in spasms and spasticity and neuropathic pain. And many people are able to recover speech and swallowing functions. So the functional gains after the neuromodulation treatment, such as motor cortex stimulation or higher cervical stimulation, are extremely beneficial. So this is the potential development area where the treatments are being developed, and there are, of course, we believe in the future this will continue to develop, and it will become more and more mainstream as we go forward. Okay. Let me see if we have any other questions. Okay. So if there are no more questions, we will sign off. And so again, if you're suffering from stroke or someone you know is suffering from stroke, please feel free to drop us a message, and we will get back to you as soon as possible with more details and more specific treatment recommendations. So there are, sorry, we have a few more questions. How long does it take for the recovery after the operation until the patient can start the treatment? Normally, the surgery is minimally invasive surgery. The craniectomy is very small craniectomy, and patients are able to recover in 2 or 3 days. So that's the initial recovery after the surgery. After 2 or 3 days, we are able to start the process, which is called mapping. So we basically map different motor centers in the brain using precise electrical stimulations. Those centers are responsible for individual functions, for example, upper body or lower body functions, speech and swallowing functions. So the mapping process can start, roughly speaking, 2 or 3 days after the surgery, and it can continue for up to 35 or 40 days. We normally need 100 or 120 hours of programming to program different areas of the motor cortex. Once the programming is completed, we recommend the patient specific treatment plans and recommendations which they will have to follow. The ultimate recovery comes after the long-term use of the stimulation, which can take few years for actual functional gains. We have a second question. What is the maximum age of the patient, and what is the difference between those two types of stem cells. The maximum, sorry, I think I will share my screen again. The maximum age, well, there is no upper limit. It depends on patient's general physical condition. As we understand, most of the patients who suffer from stroke, they are elderly patients. So, so 60 to 65 years is very common age for us to see. And some people are even 70 years old. So it depends really on their general physical condition. There is no upper limit in terms of the age. The second question is, what's the difference between these two types of stem cells? So we use two types of stem cells. We have mesenchymal stem cells and amniotic fluid stem cells. They're from two different sources. Mesenchymal stem cells are from umbilical cord tissue. So there is a jelly-like structure which is called Wharton's jelly inside the umbilical cord. That's the source of stem cells. So this is the most common stem cell type which is being used to treat neurological conditions. The second source is the amniotic fluid stem cells, which is during the pregnancy. So basically, during the pregnancy, which is between 12 to 16 weeks gestation, that's the developmental age of the fetus where the nervous system is growing very fast. In the amniotic fluid, there is a small population of stem cells, which is called amniotic fluid stem cells. So this is what we take. And the major difference is mesenchymal stem cells from umbilical cord, they have higher anti-inflammatory properties. So some patients with acute or subacute stroke, where there's a lot of acute or subacute or early chronic inflammation going on in the central nervous system, they may benefit from mesenchymal stem cells. So the transplantation of mesenchymal stem cells can significantly reduce the neuroinflammation. So it itself can promote the regeneration. For people suffering from more chronic established neurological deficit, where there is more like permanent damage, there is a lot of loss of functional tissue, and they're in more advanced stage of their condition. It's not acute condition anymore. Those patients can benefit from amniotic fluid stem cells. Amniotic fluid stem cells, they have some surface receptors which make them ideal for neuroregeneration. So they have higher potential to regenerate into nervous system tissue. So depending upon at what stage are we use one of the two stem cell types. Sometimes even we combine both stem cell types together. We have another question. Are there side effects to the motor cortex stimulation? There are some. So there are some side effects which are generally associated with the surgery. So of course there is a small craniectomy, which is used to insert the electrodes over the motor cortex. So so there is a small risk of infection after the surgery, or like central nervous system infection. The risk is extremely low. Of course, we are extremely careful and we follow very strict medical guidelines to minimize the risk of infection. This is one. Some people with with stroke, they are prone to having seizures. So we have observed some patients with underlying predisposition to epilepsy, they may have seizures after the motor cortex stimulation, although this is extremely rare. And it's mostly in those patients who already are suffering from certain level of epilepsy. In people without history of epilepsy, this risk is non-existent. So these are, I think, two common, I would say, side effects or complications associated with motor cortex stimulation. In terms of the seizure or epilepsy, although there is a slight risk of increased neural activity from the neuromodulation, which can trigger seizures, overall, we have observed a recovery in epileptic activity after the midterm or long-term use of the stimulation. Because once the nervous system goes through extensive neuromodulation, it also is able to regulate the neural activity. Okay. I think we don't have any more questions. So if no more questions, we will sign off. And um, again, if you would like to get an opinion, please feel free to share your contact details. Um, Someone from our team, they will collect more information about your medical condition, and we will process the information, and we will come up with more suitable, tailored treatment plans involving neuromodulation, um, or the stem cell treatment, or a combination of both. So we're getting more questions. Sorry. How about spinal cord injury? Yes, we actually treat spinal cord injury. Spinal cord injury is a very common medical condition we are treating. So we had been doing stem cell treatment and neuromodulation for spinal cord injury for many years, almost a decade now. And we do treat people with spinal cord injury, either cervical spinal cord injury, thoracic or lumbar spinal cord injury, and we use the epidural stimulation to treat different types of spinal cord injuries. We also use different types of stem cell treatment. So that's another treatment which is called Lamispine, where we actually also do direct transplantation of stem cells inside the spinal cord. So depending upon the location of the injury, nature of the injury, many patients, they qualify for a neuromodulation treatment involving epidural stimulation, or stem cell treatment, or a combination of both. Mm-hmm. Okay. Is there a difference in how effective treatments are for older patients compared to younger patients? I think there are many factors. I think age is not the only factor. We have seen excellent recovery in some people in the older group. It depends on the initial nature of the stroke, the neurological damage, the duration of the injury, and also patients' general well-being and their ability to perform extensive training or extensive exercise. So age is always an important factor, but that's not the only factor. There are other factors which determine how likely a patient is to respond to neuromodulation treatments. Mm-hmm. So, so many people are actually asking, how can we contact you? So we will share our contact details after this live meeting is ended. Thank you. Okay. We are also getting some questions from TikTok. My sister had a heart transplant and suffered it. Now she's paraplegic. So paraplegia is a T95, T6. Yes. So paraplegia is one of the very common medical conditions we had been treating for many years. So many people with thoracic level of paraplegia, they do qualify for neuromodulation treatment involving epidural stimulator over the spinal cord. So yes, the treatment is available for paraplegia using spinal cord stimulation. Mm-hmm. Okay. Okay. Yeah, I think there are no more questions. So thank you everyone for your time. I hope it was helpful. The purpose was to briefly present available treatment options, which are alternative options. These are in addition to what is conventionally available for stroke. So there are various options available at Verita Neuro, depending upon the nature of the stroke. So if you would like to get more information, please get in contact with us. Thank you very much.